Women's Era, brought to you by
Sunny Medical Center, Sharjah. Care is here, care is near.
വെൽക്കം ബാക്ക് ടു വിമൻസ് ഇറ. അപ്പം എന്തായാലും എല്ലാവർക്കും നേരത്തെ സെഗ്മെന്റ്സ് ഒക്കെ ഇഷ്ടമായി കാണുമെന്ന് വിശ്വസിക്കുന്നു. ബിക്കോസ് നൗ ഇറ്റ്സ് ടൈം ടു പ്രൊസീഡ് ടു അവർ നെക്സ്റ്റ് സെഗ്മെന്റ് വിച്ച് ഈസ് കെയർ ആൻഡ് ക്യൂർ. ഇന്ന് നമ്മൾ ഡിസ്കഷൻ ആയിട്ട് എടുത്തിരിക്കുന്ന ടോപ്പിക് എന്ന് പറയുന്നത് ഫീവർ ഇൻ ചിൽഡ്രൻ ആണ്. ഫീവർ എന്ന് പറയുമ്പോൾ തന്നെ അതിന് ഫ്ലൂ ഉണ്ട്, കോമൺ കോൾഡ് ഉണ്ട്, റെസ്പിറേറ്ററി ഇൻഫെക്ഷൻസ് ഉണ്ട്. അങ്ങനെ അതിന്റെ മാനിഫെസ്റ്റേഷൻസ് ഒരുപാട് വിധത്തിൽ വരാൻ സാധ്യതയുണ്ട് കുട്ടികളിൽ എസ്പെഷ്യലി. ആൻഡ് മോർ ഓവർ ഫോർ ന്യൂ പേരൻസ് അവർക്ക് ഒരുപാട് കൺഫ്യൂഷൻ ഉണ്ടാവും. കുട്ടി എപ്പോഴാണ് ആശുപത്രിയിലേക്ക് കൊണ്ടുപോകേണ്ടത്, എങ്ങനെയാണ് ഫീവർ ഉണ്ടെന്ന് റെക്കഗ്നൈസ് ചെയ്യേണ്ടത്, സിംറ്റംസ് എന്തൊക്കെയാണ്, അതൊക്കെ ആയിരിക്കും നമ്മൾ ഇന്ന് ഡിസ്കസ് ചെയ്യാൻ പോകുന്നത്. സോ ഐ വൺസ് അഗൈൻ വെൽക്കം യു ടു കെയർ ആൻഡ് ക്യൂർ. Welcome to Care and Cure. We have with us today Dr.Bharath Reddy, who is a pediatrician from Sunny NMC. And നമ്മുടെ ഇന്നത്തെ ടോപ്പിക് ഓഫ് ഡിസ്കഷൻ ഇസ് ഫീവർ ഇൻ ചിൽഡ്രൻ. ചിൽഡ്രൻ എന്ന് പറയുമ്പോൾ ഫ്രം ഇൻഫൻസ് ടു അൺടിൽ ദേ ഗെറ്റ് ടു അബൌട്ട് 15-16 കുട്ടികളുടെ ഒരു പ്രായം ഫുൾ ഫീവറിന്റെ മാനിഫെസ്റ്റേഷൻസും എങ്ങനെയാണ് പനി നമ്മൾ റെക്കഗ്നൈസ് ചെയ്യേണ്ടത്, ആസ് ന്യൂ പേരൻസ് നമുക്ക് ഉണ്ടാവുന്ന സംശയങ്ങൾ ഇതൊക്കെ എങ്ങനെയാണ് പരിഹരിക്കേണ്ടത്, എങ്ങനെയാണ് സിംറ്റംസ് റെക്കഗ്നൈസ് ചെയ്യേണ്ടത്, എപ്പോഴാണ് കുഞ്ഞിനെ ആശുപത്രിയിലേക്ക് കൊണ്ടുപോകേണ്ടത്, ഇതൊക്കെയായിരിക്കും ഡോക്ടർ ഭരത് റെഡ്ഡി നമ്മളായിട്ട് ഡിസ്കസ് ചെയ്യുന്നത്. സംശയമുള്ളവർക്ക് വിളിക്കാവുന്നതാണ്. ഡോക്ടേഴ്സ് ഹിയർ ടു ആൻസർ ഓൾ യുവർ ക്വസ്റ്റ്യൻസ്. Dr. Bharath, thank you so much and welcome to Women's Era and Care and Cure. Doctor, so നമ്മൾ പറഞ്ഞ പോലെ our topic today is fever in children. So like I mentioned in the introduction, I think new parents, young parents will always have a lot of doubts about recognizing fever in infants.
Yes.
So if we can start with that, doctor, in terms of identifying the symptoms of fever in a baby, in a newborn baby.
It's a very common thing in our pediatric OPD because 3 out of 4 cases is fever.
Fever, right.
Few parents come with complaints of fever, just not recording the temperature,
Okay.
just telling that its body is hot, head is hot,
Okay.
they're crying too much. But ideally, I suggest that record the temperature.
Okay, okay.
Record the temperature in the house, see whether it's really fever or not. Because fever can be various causes. Mainly it's because of infections, but we have to recognize whether fever is there or not.
Okay.
It's very simple process.
Okay.
Using just a digital thermometer, putting it in the armpit and,
Okay.
and recording till it beeps or around 1 minute.
Okay.
And if it's more than 99 degrees Celsius,
Okay.
Fahrenheit, or
Fahrenheit.
38 degrees Celsius, then you would call it as fever.
Okay. 99 degree Fahrenheit and 38.
You can add
degrees Celsius.
0.5
Okay.
to 1 degree extra if you're measuring it in the armpit.
In the armpit.
Armpit.
Okay. Okay.
Other than that, few symptoms like if a child is very small, suppose child is less than 1 year,
Okay.
child keeps on crying, excessive crying.
Okay.
Child will not feed, child will not sleep well, child might not pass urine, they keep on vomiting, they're more irritable. All these symptoms also suggest some infection is there in the body.
Is there in the body?
It might be fever is there, better to check temperature. If
Okay.
it is more, you better go to the nearest doctor availability.
Doctor, okay. Doctor, now sometimes fever in especially babies less than a year old, it can, if not resolved in a certain amount of time, it can aggravate to other infections.
Yes.
Like say upper respiratory tract infection or cold. And running nose and things like that. So how do you identify the symptoms of those, doctor? Has it progressed into a respiratory infection? Is there
Yes.
any pointers for that?
Fever might be because of many causes.
Okay.
Starting from common cold to severe brain infection.
Okay.
Most of the time in our setup, it's mostly respiratory infections, as you told.
Yeah.
And respiratory symptoms might be just a common running nose,
Okay.
nose block,
Okay.
slight throat infection causing some dry cough, or severe chest infection causing productive cough. Means the phlegm keeps on coming.
Okay. Okay.
If it is mild, child might have just a fever,
Okay.
little cold like running nose, nose block, associated with they'll have difficulty in breathing. Because
okay.
of the nose block.
Right.
If it is severe because of chest infection, we call lower respiratory infection.
Okay.
They'll have chest indrawing.
Okay.
The respiratory rate might be more. They keep on vomiting. They
Vomiting.
will be more lethargic. They'll be more sleepy. And they might not be active as such.
Okay. Okay.
So depending upon the age also it matters.
It matters,
Suppose if
okay.
the child is less than 6 months,
Okay.
especially less than 3 to 4 months, if any fever, it has to be shown immediately to the doctor.
Immediately. to
Because
the
it's
doctor,
very
okay.
not very common in children less than 6 months. Because there will
Okay.
be some immunity which has been transferred from the mother
From
to the,
the mother to
the
the
baby.
baby. Yes.
And
yes.
mother baby is already on breastfeeding.
Correct.
Because of that, some protection will be there.
True.
So any fever less than 6 months without any vaccination or immunization, you have to show immediately to the doctor.
To the doctor.
If
Okay.
it is more than 6 months to 1 year, if it is more than 101, 102, around 1 day, better to show to the doctor nearby.
Okay,
Or
okay,
wait
right.
till 1 day, see if the child is dull, not feeding well, show to the doctor.
Okay.
If it is more than 102 or 103, better to show within 24 hours.
Okay. Okay.
See, little home remedies or little
Observe,
oral
okay.
medicines. If you can try in the home, and but show to the doctor within 24 hours if it's not subsiding.
Right.
If it is very high, like 104 or 105,
Oh.
I suggest to go immediately
Immediately
within few hours to the doctor.
To the doctor. Okay, doctor. If suppose a child does not have fever and only cold, like a common cold, is there chances of that changing into a fever?
Yes.
Or can we just stick to home remedies and not visit the doctor? at all?
Common cold might be because of various viruses.
Okay.
Usually, if it is flu viruses, usually it will be associated with severe fever. If it is because of some other viruses,
Okay.
there are hundreds of viruses which can cause common
Common
cold.
cold.
If it is just common cold without fever, just home and remedies, giving plenty of liquids,
Liquids. Okay.
and any nasal suction if there is nose block, if nasal drops, saline drops to clear the nose suction. Proper rest and easily digestible food can be
Okay.
given to the children.
To the child.
If the
okay.
fever starts coming, associated symptoms like cough starts coming, child is more irritable, then you can show to the doctor.
Oh. Okay.
Usually common colds will be there for 2 to 3 days.
2 to 3 days. Okay.
Usually and subside by itself.
By itself, right?
Even though if we give treatment, we see whether it's chest involvement is there or not. If chest involvement is there, we also treat. Otherwise, we also go in the same lines.
Okay. Okay. An intervention is not necessary.
Not necessary in all the cases.
Right.
In 70 to 80% of the cases, it's common cold which is causing fever, which doesn't require any treatment.
Any treatment.
Any
at all.
treatment. It subsides by itself with just simple remedies.
Okay, that's I think a very interesting point, doctor, because a lot of parents, when it's a common cold also, they tend to immediately start giving antibiotics
Yeah,
and start.
the newer thing is they start their own antibiotics and come to us.
Correct.
That's
yeah.
a wrong thing because common cold is mostly caused, 90% it's because of viruses.
So
Some secondary infections might be there, but it's
Okay.
mostly viruses. Doesn't require antibiotics.
at all.
Just
yeah.
plain paracetamol, adequate fluids,
Yes.
proper rest, and sponging. If the fever is the whole body sponging with
Okay,
water,
okay,
those
okay.
things can be helpful.
Yes. Okay, so that was in fact my next question, doctor, because back in the day when we all used to have fever, the first thing that our parents, our mothers used to do is give a cold press.
Yes.
So it's either a normal cotton or a muslin
Yes.
cloth on your forehead, on your armpits, and on the sole of your feet, your palms, or sometimes they even used to use eucalyptus oil.
Yes.
So, doctor, is this in today's day and age for the kind of infections that we see today? Is that a good remedial measure or
For reducing the fever,
fever?
it's a good remedy. Still, it's a good remedy.
Okay.
Any children less than 6 months, especially 5 years, I'm
5
telling
years.
about,
Okay.
if fever rises suddenly, there are chance of having the convulsions or fits, we call it.
Fits.
Fits.
Yes.
It's called febrile seizures.
Okay.
To avoid that, you can give oral paracetamol, but
Okay.
it will take some time to act.
Act.
In between time, whole body sponging,
Okay.
not only just the head. You just put some cotton
Only
cloth on
on
the head.
Oh.
It's not the whole body sponging. Not very cold water, not warm
warm
water,
water.
little lukewarm water.
Okay.
Just you can give and do sponging.
Okay.
That will reduce the body temperature.
Right.
It's just exchange of heat.
Exchange of heat. That's
Heat,
right.
that's it.
Okay, doctor, we have a caller on the line. Hello.
Hello,
Good afternoon. Welcome to Care and Cure. ആരാ വിളിക്കുന്നത്?
ഇത് സീമയാണ്.
സീമ.
സീമ.
ഓക്കെ, സംസാരിച്ചോളൂ, ഡോക്ടർ ഉണ്ട് കേട്ടോ.
Okay. Doctor, I just want to know about this climatic change fever, how it is affecting the kids. Actually, my baby is having allergy.
Okay.
So he is getting a fever in every
Seasonal.
Dubai, according to the climate, he is getting.
You meant seasonal fever, seasonal allergies?
Yeah, seasonal allergy and plus this fever is coming. So the doctor, our consulting doctor is saying that he has to give him this nebulization in every day when we are going out.
Okay.
So is that good?
Nebulize. What's the age of your child?
He is just 5 years old.
5 years old. He's having this allergy since what age?
Yeah, he is having this allergy.
Since what age? After ഇവിടെ വന്നിട്ട് ശേഷമായ ഇതിക്ക് മുമ്പേ ഉണ്ടോ അലർജി? After coming to Dubai വന്നിട്ട് ശേഷം?
After coming to Dubai.
Okay, it might be.
He is here for after his birth. He is here.
Okay.
So ഈ വിന്റർ ആവുമ്പോ ഒരു ടൈം ഇതുണ്ടാവും. പിന്നെ ഈ ചേഞ്ചസ് വരില്ലേ ക്ലൈമറ്റ് ഹോട്ടും കോൾഡ് ആവുന്നതിനനുസരിച്ചിട്ടാണ് അവന്റെ ഇത് വരുന്നത്.
Usually the seasonal allergy, we call it seasonal allergy. Usually it might come in cold seasons, especially in December and January because of this weather.
Yeah, and also in this season also.
Because of the dust and all, when it becomes too dry, the weather becomes too dry. Because of the dust in the air also can trigger. There are many triggers. The allergy as such is not completely treatable. It can be only prevented. But the number of symptoms are coming daily, weekly, monthly. Depending upon the frequency, we have to decide the line of treatment. Suppose if he's having allergy very 2 months once, 3 months once, just nebulization or some oral treatment is enough. But it is having regularly, like every week, every day, every night, it's disturbing his sleep, his regular activities, his playing and all, then he requires just not nebulization. He might require some other medications which has to be decided after seeing the child.
He had given us another tablet for 3 months. I forget its name.
It might be Montelukast, I think, tablet daily.
Yeah. He gave that and asked us to continue as far as we can. Actually,
Anything better after starting it?
Yeah, we started it. It's been 6 months.
Okay.
കുറവുണ്ടോ
better.
കുഞ്ഞിന്? Is there a difference?
ഈ ഒരു പ്രാവശ്യം കുറവാണ്. ഈ പ്രാവശ്യത്തെ സീസൺ ചേഞ്ചിന് അങ്ങനെ ഇത് വന്നിട്ടില്ല.
Maybe അത് continue ചെയ്യണോ? If again any wheezing, I mean cough is there, nebulization can be given. Slowly by age he'll get better. Nothing to worry.
Nebulization, it's good. It's good now.
Maybe you can continue that medicine. If he's not responding still to that medicine, then you have to go to next line after the treatment.
Yeah.
Otherwise, nothing to worry. He'll get better with age.
Okay, അലർജിക് വരുമ്പോഴേ ഫീവർ അതും പ്രോബ്ലം ആണ്. മീൻസ് അത് ഭയങ്കരമായിട്ട് ചെസ്റ്റ് കൺജഷൻ കൂട്ടി ഇതാവുകയാണ്.
Occasionally, because of some secondary bacterial infections or some viral infections itself, can cause chest congestion. But if it is severe, causing recurrent chest infections, that indicates that his allergy is increasing. Then we have to go for next line of treatment. Even some allergies can also secondarily cause secondary chest infections. So if it is again coming like that, then you have to go for next line of treatment.
Okay. Thank you, doctor.
Thank you.
Thank you.
Bye. So, doctor, going by what our caller had asked, the allergic reactions that children have, I think after certain age they will start diluting, right? And if it doesn't, that is when you have to take for the next level of treatment. That's what you mentioned.
What happens is allergy will be there.
Yeah.
It might be because of familial causes or because of the environmental causes.
True.
If they're familial, they're more prone
to it. Yeah.
If they are not given adequate treatment at the right time, those children are the prone which are chance of getting continued in their lifetime. Otherwise, if proper treatment is given, the chance of subsiding over the age is more. So, early intervention treatment
is better. Right?
Just not going for next line therapy, just stopping with just nebulization or oral some symptomatic therapy will not. Better to give adequate proper treatment.
Right.
Otherwise, it might go on.
Okay. Doctor, nebulization as a method of treatment. This is, I think, it's used for chest congestion. Is that correct?
There is actually lungs in the lungs.
Okay.
There are some airways, there are tubes in the chest.
Correct.
When they become narrow, then the child becomes difficult in breathing.
Okay.
Just to open up the airways, we put some medicine,
right,
and give directly.
Okay.
Instead of giving syrup, which acts throughout the body.
Okay.
If you give through the nebulization, it goes and acts at the site
Directly, okay.
where it's required.
Where it's required.
So the
okay.
lesser number of side effects and faster action.
Faster action.
So we give nebulization.
Okay. Is it okay to continue that as a regular means of treatment, doctor? Like in our in Sinu's case, she mentioned that they're doing it at home. They don't even go
It's not regular means the frequency has to be seen.
Okay.
If the frequency is so means weekly twice, weekly thrice, daily having in the night times, then they have to go for next line of therapy.
Okay.
Just occasionally using it if maybe is okay. Not regularly, not daily.
Regularly. It shouldn't become a lifestyle
yes.
remedy.
We have to look look for any other cause which is we have to identify the cause and treat it.
Right.
Because we just neglect it and it might lead to other chest infections.
Right. That's interesting, doctor, because for allergies, I think it's important that we treat the underlying issue, the cause of the allergy and not the symptoms.
Treating the cause is difficult, but at least avoidance of few things.
Correct, yeah.
Knowing the prevention.
Okay, so in this case, doctor, I know it's a very seasonal thing and a lot of parents, I'm sure, are facing this issue with the child having this sort of chest congestion fever when the seasons are changing.
Yes.
So in terms of prevention, is there something that can be done for this seasonal flu that comes?
Very difficult actually. Because of this climate and the school timings and all, they have to leave early, and because of the dust outside, which is difficult to avoid, and in the school, so many students stay together in a closed place.
Correct.
Chances of infections also triggering this allergy. It's very difficult to avoid. Few things like avoiding some cold substances, that can be done.
Okay. So food is one of the...
Food is one of them, but completely avoidance is difficult.
Correct. Right. Okay. Doctor, now in the case of fever, another thing that I want to ask is in case of new parents with a newborn baby, say the baby is less than a year old, a lot of new parents are very careful when people with infection visit them or try to, visit the baby, or when they take the baby out. There's infection everywhere. You really don't know how you can prevent the infection from spreading to the child. So in cases like this, if the parents are too scared, if the parents are really afraid, if they have so much of fear, is there any tips that you can offer in terms of how you can ensure that your baby doesn't contract illness and infection from outside and from other people?
Main thing is hand washing. Hand washing is the main thing which can be used to prevent infection from one kid to other, or from parents to the children, or some relatives,
or strangers,
or relatives who come to see the child.
Correct.
Especially the newborns, using some alcoholic rubs or proper hand washing is just used enough to prevent the spread of infections.
That's more than
more than enough, because we can't avoid the spread of infections through the air. Proper hand washing, those things can be done. Keeping the surroundings clean in a closed place. Keep the baby warm. Proper hand washing and proper breastfeeding to the baby, especially for less than 6 months to 1 year. I think that will do.
That is more.
More than enough.
Okay. Also, discussing what we were talking about earlier, doctor, about the cold press eucalyptus oil, using all of that. Is it safe to use all of this in a baby? Like, for example, there's so many different ointments and balms that are available in the market today. Like, there's regular Vicks that where adults use, and then there's tiger oil, tiger balm, and all of that. When it comes to a baby, what kind of things can be used?
We are discussing regarding the nasal block and nasal congestion and the common cold.
Right.
In the common cold, tepid sponging or the just body sponging is enough to reduce the body fever along with the paracetamol. And coming about these bombs and all, it can be used, but very little amount on the chest, which can relieve the nasal block. But one more thing is, if you apply too much, it might irritate the skin. It might irritate the skin. And applying regularly also, few bombs and all have chemicals. It's not very good for the babies. Because even in small babies, it might get absorbed through the skin also. And can cause local dermatitis if they're more allergy prone. Try applying very little, or just saline nasal drops will clear the nose block. And steam. In a small bathroom, you can just apply steam and just sit in the bathroom so that the nose block can be relieved. If it is possible.
Not a direct steam, right?
Not a direct steam for the babies.
Because for the babies.
Not baby. Just plain saline nasal drops are enough.
Now, all these medicines, doctor, I think also it's important for parents to recognize that they can't start self-medication in a baby, right? It has to always be through
especially for
Prescription.
small babies,
Yeah.
infants less than 1 year.
Yeah.
Prescription, because we give medicines based upon the weight of the kid.
Mm.
So it's better to visit the nearest doctor to you
Okay.
and take the medicines.
Okay.
Not for the less than, especially not less than 1-year-old kids.
True.
If you're planning to give, at least maybe it's limited to paracetamol.
Mm,
Plain paracetamol just to reduce the temperature.
Okay.
That can be used, not more than that.
Not
I
more than
advise.
Okay. Okay. Doctor, now coming back to the chest infection that we were discussing earlier, even talking about a caller who said that a son has wheezing and he's in constant need of nebulization. I've heard that once when a child is really young, if they get this sort of a complication, then they become more prone to chest infections each time, the seasonal change
Yes.
happens and the
Yes.
fever happens. Is there any way to avoid that, or is it something that the child has to live
Recurrent
with?
chest infections might be one of the cause for allergies. Underlying
Allergies.
allergy can cause recurrent chest infections.
Okay.
Maybe treating allergy can itself subside.
Okay.
And with proper, just giving nebula, few parents just give nebulization. They might have taken once or twice in the advice of doctor. Same thing they would have continued in the home without with it. Just
Right.
giving temporary nebulization. Secondarily, they might get infection, chest infection. Then they go to the doctor.
Then they go to the doctor.
Then they
yeah. Yeah.
So maybe if the treatment is not proper, and self-treatment can also lead to chest infections.
Okay. More
More
severe
infections.
Right.
So treating the allergies
Mm.
can indirectly reduce the chance of chest infection.
Okay. Okay.
And those
And
things.
Doctor, allergies. What is there a right age to start treating allergies? Because when a baby, infants, treatment of allergies is generally, people think that there's a lot of steroids that are used. There's a lot of heavy dosage of medicines that goes.
Yes.
So when it comes to a child, when it comes to an infant, what is the appropriate age to start treating allergies?
Usually till 1 year we still wait. It might be still viral infections can
Correct.
triggering all these
Mm,
things.
mm,
After 1 year, still the child is having recurrent episodes
Mm.
leading to chest infections,
Right.
cough,
Mm.
which is a variant of allergy,
Okay.
or family history of allergy is there. Then we take all these into consideration and then treat it.
Then
Just not by the age, just not by one symptom. You have to take
Okay.
all these things into consideration.
into consideration.
And
Okay.
then-
All right. Okay, so we are in conversation with Dr. Bharath Reddy, who's a pediatrician, and we are discussing fever, common cold, and chest infections in children. The viewers, സംശയമുള്ളവർക്ക് വിളിക്കാവുന്നതാണ്. Doctor is here to clarify all your doubts. So, ഇപ്പോൾ ഒരു ചെറിയൊരു ബ്രേക്ക് ആണ് Karen Curl, but stay tuned, we are still here.
Women's Era, brought to you by
Sunny Medical Center, Sharjah. Care is here, care is near.
വെൽക്കം ബാക്ക് ടു വുമൻസ് ഇറ. ഇപ്പോൾ ഇവിടെ നടന്നുകൊണ്ടിരിക്കുന്ന സെഗ്മെന്റ് ഇസ് കെയർ ആൻഡ് ക്യൂർ. നമ്മളോടൊപ്പം ഉള്ളത് ഡോക്ടർ ഭരത് റെഡ്ഡിയാണ്, ഹൂസ് എ പീഡിയാട്രിഷ്യൻ ഫ്രം സണ്ണി NMC. ഇന്ന് നമ്മൾ ഡിസ്കസ് ചെയ്തുകൊണ്ടിരിക്കുന്ന ടോപ്പിക് ഇസ് ഫീവർ ഇൻ ചിൽഡ്രൻ. ഫീവർ എന്ന് പറയുമ്പോൾ ഫീവർ മാത്രമല്ല, പക്ഷെ അതിനോട് ചേർന്ന് വരുന്ന പല മാനിഫെസ്റ്റേഷൻസ്, പല ഇൻഫെക്ഷൻസ്. കാരണം ഫീവർ എന്ന് പറയുമ്പോൾ തന്നെ ചെസ്റ്റ് ഇൻഫെക്ഷൻ ഉണ്ടാവാൻ ചാൻസ് ഉണ്ട്, ഇയർ ഇൻഫെക്ഷൻ, ത്രോട്ട് ഇൻഫെക്ഷൻ, യൂറിനറി ട്രാക്ട് ഇൻഫെക്ഷൻ, അങ്ങനെ പല വിധത്തിലുള്ള ഇൻഫെക്ഷൻസ് അതിനോടൊപ്പം ചേർന്ന് വരാൻ സാധ്യതകളുണ്ട്, എസ്പെഷ്യലി ഇൻ ചിൽഡ്രൻ. ഇതൊക്കെ റെക്കഗ്നൈസ് ചെയ്യേണ്ടത് എങ്ങനെയാണ്? ഇതിന്റെ സിംറ്റംസ് എങ്ങനെയാണ് ഐഡന്റിഫൈ ചെയ്യേണ്ടത്? എപ്പോഴാണ് ഒരു ഡോക്ടറെ സന്ദർശിച്ച് നമുക്ക് മെഡിസിൻസ് എപ്പോഴാണ് തുടങ്ങേണ്ടത്? ഇത്തരത്തിലുള്ള കാര്യങ്ങളൊക്കെ ഡിസ്കസ് ചെയ്തുകൊണ്ടിരിക്കുകയാണ് നമ്മൾ. വ്യൂവേഴ്സ്, കോളേഴ്സ് സംശയം ഉണ്ടെങ്കിൽ വിളിക്കാവുന്നതാണ്. ഡോക്ടേഴ്സ് ഹിയർ ടു ക്ലാരിഫൈ ഓൾ യുവർ ക്വസ്റ്റ്യൻസ്. Doctor, going back to a little bit more detail into fever as such. A lot of parents, a lot of adults generally, for example, even I have this doubt as to how to distinguish viral and bacterial fever, because whenever there is a fever, I'm guilty of doing self-medication as well. If I know that I have a temperature, if I know that I have a throat infection, I immediately have antibiotics.
Yes.
So is that something that is advisable, doctor, or what needs to be done?
The initial first 2 days, it's very difficult to differentiate
Okay.
whether it's bacterial or viral.
Or viral.
Just by symptoms.
Okay. The
But
symptoms are the same, doctor? in the
almost
first
look
two-
similar, especially
Okay.
respiratory infections. They
Okay.
almost look same.
The same.
Both will have fever.
Mm.
Both will have running nose, nose block,
Okay.
mild throat congestion, throat pain
Throat
will
pain,
be there.
yes. Sore
Little-
throat. And all
yes,
of
sore
those.
throat can be there.
Yeah.
But usually viral subside by next 2 to 3 days. Gradually subsides. It might be sudden rise of temperature might be there in the first day, but
Okay.
slowly they wane off.
Okay. Okay.
Whereas bacterial, the temperature keeps on increasing.
Okay. So
The
that's
sore
the
throat
main-
keeps on increasing.
Increasing,
Even after third day, the symptoms still aggravates.
Okay.
It might even spread to the ear, causing ear infections. Viral also can cause ear infections.
Ear infection. Okay.
But bacterial, still the chance of getting ear infections or more.
Are more. Okay.
Other than that, fever starts increasing.
Mm, mm,
It might spread to the chest, causing chest congestion.
mm.
Productive sputum. If it's a bigger child, they can bring out the sputum.
Okay.
The smaller child, they can't bring out the sputum.
Okay,
They just
okay.
swallow it.
Swallow
We can't
it,
differentiate by looking at the sputum in small children.
Okay. Okay.
So the fever is the main thing, and the symptom starts increasing.
Increase.
And
Okay.
requires some clinical examination, examining the throat, any
mm.
pus in the throat. Those things has to be examined.
Okay.
If it is still not able to differentiate, if the very high temperature is there in the first 2 days, requires some basic blood test or some throat swab can be done to
Okay.
differentiate.
Okay.
But bacterial is less likely than viral. It's more the viral.
Viral
So
is more
starting
common.
antibiotic in the first 2 days, it's not advised.
Not
If
advisable.
the
Very
symptoms are
important.
aggravating, then consult the doctor. If required, then you can start the antibiotic.
Okay. Doctor, I think even in antibiotics, there are different dosages depending on the
Yes.
severity of the infection.
Yes, there are different dosages, especially that I told as previously. For the kids, we give it up based upon the weight.
Weight. Okay.
For the syrups, usually for the kids. And different types of antibiotic for if it's a throat infection, ear
Okay.
infection, chest infection,
Okay, okay.
stomach, abdominal infection or urinary infection. So different types of antibiotics are there.
Okay.
So just starting some random antibiotic at
Yes.
random doses
Yes.
can cause resistance in the antibiotic. That antibiotic might not work again
At all,
for you.
yeah,
You have to increase the dosage of the antibiotic, or you might go for injectables. And the problem of resistance is because of all this. Because of this.
All these. I think that's a very important point, doctor, because a lot of I've
Yes.
seen a lot of parents do this with their child, and I've seen a lot of adults also do this, where they automatically start consuming any antibiotic without checking the underlying cause of the
Causes.
infection, right?
Because if you keep on giving randomly give antibiotic, the fever might have subsided. We don't know whether it's because of the antibiotic or because of the natural immunity or because of some
Correct.
virus infection.
Right.
Parents might have thought because of antibiotic
of
and they keep on giving the same thing.
Right.
The next time when the infection becomes severe, that antibiotic might not work.
Might not.
Then we have to go for some blood tests, some
Right.
injections.
Oh.
Then it's again painful for the child.
Yeah, it becomes worse than
Worse for the child.
what it was. Doctor, taking the point that you mentioned previously, now fever is caused by a lot of other infections as well. You said it could be a ear infection, it could be like
Throat
infection.
infections.
Yes.
It might be stomach infection causing diarrhea or urinary infection. There are so many things.
Okay. Okay. So, how can a parent identify the infection before it progresses into a full blown out viral fever or
Suppose we take it respiratory infections.
Yeah, let's take
It might
one by
start
one.
with a fever or it might start with some respiratory symptoms.
Okay.
Respiratory symptoms like running nose,
Okay.
nose block, difficulty in breathing because of the nose block and nose congestion,
Okay.
throat pain and throat irritation,
Okay.
and dry cough because of the throat irritation, and vomiting sensation or nausea because of the throat irritation.
Okay.
It
And
might
this might have a fever and might not have a
might
fever
start
also.
with these
Okay.
symptoms
Okay.
followed by fever,
Followed by fever.
or fever followed by these symptoms.
Okay,
It can be
okay.
anything.
Right.
Or it might be flu, where
Okay,
it will be fever and common cold symptoms together.
Okay. So
Okay.
fever with common cold is
Fever
commonly
and
known
flu
as flu.
are almost similar,
Okay.
but flu is mainly caused by influenza virus. Common
influenza
cold
virus.
is caused by many multiple viruses.
Yes.
Main thing is flu. You have to remember it is symptoms are quite severe, like
Mm.
fever, high grade fever, full
Okay.
body pains. If the child is little big, they can tell that they have headache.
They have headache.
Along with that, some cough, dry cough, irritating cough, irritable
yeah.
cough. It's mainly seasonal. It might usually come in July and August.
Mm.
Whereas these cause literally patient will be bedridden because of severe body pains.
Severe body pain.
But usually subsides by 3 to 5 days.
Okay.
Rarely they might go for some chest congestion and chest infections.
Okay. Okay. This is still is it a viral?
Still, it's a
infection,
viral.
doctor? Okay.
Doesn't require any antibiotics.
Antibiotics. Even
Just
though it's so
symptomatic.
severe.
Even though it's just plain paracetamol, proper bed rest,
Bed rest.
and hydration. Plenty of fluids. This
Okay.
is enough to
Okay.
If we can do some throat swabs to
Okay.
diagnose it. After diagnose, if it is because of influenza, then you can just as such, as told, just
Continue
paracetamol and
medicines.
hydration
Right,
and bed
right.
rest is enough.
Okay.
Common cold can also cause similar symptoms, but the fever, it might not be high.
Okay.
Body pains, headache will not be much.
Right.
They also subsides within 2 to 3 days.
Okay.
Both the cases, antibiotics are not required.
Not required.
Not required.
Okay. Okay. So this is flu, doctor. Now, respiratory infections. You've mentioned the symptoms. If it's a ear infection, does it have the same symptoms?
Few children are followed by these throat infections or nasal infections can spread to the ear, especially kids less than 5 years.
They are
chance of spreading to the ear or more.
Okay.
They have ear pain.
Okay.
And difficulty, decreased hearing sensation. Because of the fluid accumulation in the ear, same as the nose,
Yes.
the hearing capacity will decrease.
Okay.
They can't hear well with severe ear pain.
Ear pain.
Or associated symptoms like fever, throat pain, nasal congestion, those symptoms will be there.
Okay.
Associated with ear pain and decreased hearing, then you can think of ear infection.
Okay.
Then it requires pediatrician or ENT. Consultation.
Okay. Okay.
Even the pediatricians can do it. They check the ear and adequately treat it.
Right. When you spoke of this, doctor, what I immediately remembered is since we are all expats and we live in this region, we fly back home frequently. Some of us frequently are frequent flyers. So I've heard that a lot of children, when they have a cold or a fever and when they're flying, the ear pain tends to increase because of a change in altitude and all of that.
Even we have it.
Even we have it, yeah.
When if there is cold, it's more.
It's more. So is there anything at all that parents can do to reduce the pain in the ear besides the medicines, or?
Usually what we do, we just swallow.
Yeah.
But kids, we can't tell them.
We can't tell them, right.
But little smaller kids, maybe feeding, breastfeeding can be done. So
yes.
that when they swallow, automatically that ears open.
Yes.
There is a eustachian tube connecting from throat to the ear.
Okay.
That gets closed.
Okay.
When we just swallow, it might open because of the pressure changes. And that fullness of the ear gets relieved.
Yeah.
And taking a small toffee or anything, chewing something can relieve the symptoms.
Okay, these are the basic things.
Yeah, but usually they'll get better.
They'll get better, yes. Okay, doctor, now moving on to stomach infections and the symptoms and how that, progresses into fever. Could you explain that also?
Stomach infections is mainly because of improper hand washing or eating outside, where it might have spread through the food. It might also present like fever associated with abdominal pain, with stomach pain, vomiting sensation, with diarrhea. That's all loose stools.
Okay.
It might be. It's also usually viral.
Okay.
It's also usually viral and subsides by 2 to 3 days. Unless they'll have bloody diarrhea, some mucus in the diarrhea, severe fever, not subsiding within 2-3 days, then you can think of bacterial.
Okay.
Then you can do simple stool tests.
Okay.
And if it's bacterial, we can treat with antibiotics.
Okay.
Or if it's viral, as I told, paracetamol. Pain relieving medicines, proper hydration, some electrolyte solutions. Those can be some probiotics. Those can be used.
Good rest. As
such.
Doctor, without diarrhea, if a baby only has stomach pain, is there any way that a parent can identify that it is due to stomach pain? Or
if it is smaller kid, less than 2 years, they keep crying.
They
start touching if it's especially less than 6 months, usually it's colicky pain.
Okay.
It's usually while feeding, they swallow the gas, air also into the stomach. Okay. They might not release it. Because of that, they'll have some evening and night time, they'll have colicky pain.
Okay.
Usually proper burping of the child, and few medicines can relieve those things. Can relieve those things. It's very common in first 4 months of age.
Okay.
And subsides by that after that. And for little bigger children, they might tell or they might just touch the tummy or just stomach. Keep on crying.
Okay.
It might be because of some food or some mild viral infection. Usually subsides by itself.
Okay.
If it is recurrently having it, then we have to evaluate.
Okay.
Because other causes like urinary infection can also cause stomach pain.
Yes.
Some previous stomach infections can also cause mild stomach. You have to evaluate regarding accordingly.
Yeah, my next question was UTI, doctor. I've heard that girls are more prone to UTI.
At some age, girls are more prone.
Okay.
After some age, all are equally prone. Boys and girls are equally prone.
Right.
Equally prone.
What are the symptoms? Could you just explain?
Symptoms, they also start with fever.
Fever, okay.
They'll have increased micturition, means increased urination, urge of urination.
Okay.
Pain or burning pain, sensation while passing urine.
Passing urine. Okay.
And they might, because of the pain, they might not pass urine. Few kids.
They'll hold it back.
They'll hold the
Fear.
urine.
Oh, okay.
They might have. Those, usually these are the commonest symptoms.
Okay.
So those also depends upon the age.
Mm.
If it is less than 6 months to 1 year, they might excessively cry. They might have fever. They might not feed well. They might become lethargic.
Okay. Okay.
If it's more than 1 year, same thing, fever, stomach pain.
Stomach pain.
They might have pain while passing urine. There will be burning pain while passing urine. They might not micturate, or they might frequently micturate because of the pain.
Okay. Okay. Is there a test that can be done to determine whether it's
Simple urine test can
urine test
detect.
can be
If it's not detected, gold standard is urinary culture. But simple urine test can detect whether it's urinary infection is there or not.
Okay.
If urinary infection is there, then you have to find out what is the organism
Okay.
and start with the antibiotics accordingly.
Right. And is it true that, doctor, once you get UTI, you're more prone to getting it in the future?
It's not that once you get UTI, if it is they're getting and again, then you have to evaluate.
Okay.
What is any underlying causes, any structural abnormalities,
Okay.
any external or internal structural abnormalities, or there has to be evaluated. Then urinary cultures has to be done. And depending upon the culture organism, proper dose of antibiotic and proper duration of antibiotics. Maybe if they would have started antibiotics, they might have symptoms might subside within 48 to 72 hours. Parents would have stopped.
Would have automatically
stopped the antibiotics.
Yeah.
The bacteria is not completely cleared.
Gone.
So they keep on getting. One thing. So proper duration, proper dose of antibiotics. If you give, usually it subsides. If still coming, then you have to look for. You have to do an ultrasonic scan to look for any structural abnormalities.
Right. Okay.
If associated any constipation or anything has also to be looked at.
Right. Is this something that can be hereditary passed on, or is it independent of any such
it's
causes?
not as heredity.
Okay.
It might be some external causes causing
only.
infection.
Okay. Right. Doctor, now moving on to the previous thing that you briefly mentioned about when there's a severe chest congestion, generally I've heard doctors encouraging children to spit it out. You cough, you take the infection, the phlegm, the sputum out and spit it. But with younger children, with infants, it becomes
difficult.
Tricky. So
they might not.
Yeah.
Usually kids less than 5 years, even few kids less than 8 years can't spit out the sputum.
Yeah.
They might swallow it.
Yeah.
Or if it is mild, it might get resolved from the chest itself.
Okay.
Even though if it's swallowed, it might excrete it, or it might, few children even because of continuous swallowing, they might vomit it out also.
Vomit it out, okay.
So nothing wrong. It's if they are good enough to expectorate it out, that's good. If not, if they swallow also, that doesn't matter.
Yeah.
Doesn't
And
matter.
also I've seen that a lot of doctors prescribe expectorant as a cough syrup to encourage more cough and to bring out this. Because I've seen a lot of mothers, they don't buy if there's in the prescription, if it says expectorant, they say, are you the Vanda, because it's going to increase the cough and the child is going to keep coughing. But the positive thing is it's going to encourage the sputum to be expelled from the system, right?
Yes.
So it's a good thing.
Expectorants are something like few suggest it might work, but as such it might not work also.
Okay.
Even just I told proper hydration. Proper
Mm-hmm.
hydration, proper bed rest. And mild expectorant, not long duration of expectoration is also not advised actually.
Okay.
Maybe short duration of expectorant may be okay. If it is because of the chest wheezing, means blockage of the airways, maybe giving medicine to that might be helpful. Not on all the cases it might work.
Okay.
If it is just a dry cough, not an expectorant cough, it might not be helpful at all.
Not helpful at all.
If any severe chest congestion is there, any blockage of the airways, and because of an allergy, wheezing is there. There's a condition where there is narrowing of the airways. In those cases, those to dilate the airways, to remove the phlegm might be helpful. Not all the cases.
Not all the cases.
Most of the cases, just giving little warm water, those little home remedies can also be helpful.
So I think parents should avoid self-medication, because some of them will have an expectorant at
because
home.
If you keep on giving, we never know.
Yeah. Right. Okay.
Few expectorants have some cough suppressing agents also.
Okay.
There are so many combinations. It's not available here.
Okay.
Few have coughs, means few, especially those brought from home. They have combinations where they have cough suppressing agents with that.
Okay.
So giving that might not be very good for all the cases.
For children especially. Right. Okay, doctor, you mentioned home remedies. I know a lot of parents, they'd rather do how much ever possible at home before they can, before they get to the stage of taking the child to the doctor. So could you explain home remedies that parents can adopt?
Home remedy starts with adequate hydration.
Hydration,
Little,
right.
plenty of water, because when there is chest congestion
Right.
or nasal congestion,
Right.
there is water loss.
Water loss.
There'll
And,
be
doctor-
associated fever also.
Yeah.
There also water loss.
Okay,
will be.
sorry. This is applicable for all the types of infections we spoke right now? All these home remedies? Or is it specific to certain infections only? Like
I'm a bit stressing on the respiratory infections.
Respiratory infections. Okay, right.
In spite of that, hydration is more important.
Yeah.
Hydration is more important in all the cases.
All
if
the
it is
cases.
diarrhea or urinary infections as
Yes,
such,
yes.
respiratory infections, hydration is more important.
Is standard.
Because especially during infection, when there is fever, their appetite comes down. They
Okay.
can't eat well.
Okay.
Because same like us all, kids are also same like us.
True.
So they might not eat well, giving plenty of liquids in the form of water, or like some kanni, like rice water,
Correct.
dal water, little soft rice, smashed rice with little of rasam or anything can be given for the kids.
Okay.
Like first thing is that.
Is that okay?
Because, and if suppose the child is less than 6 months or 1 year, continue the breastfeeding. Don't stop the breastfeeding.
stop breastfeeding.
Even the child is having some infection or mother is having infection, breastfeeding shouldn't be stopped.
Okay.
Stop.
Okay.
Because few stop the breastfeeding thinking that it might aggravate it.
Correct.
Because
Yeah.
breastfeeding is protective. So
Okay.
better
It's
not
the
stop
best
it.
immunity
Best
for the-
immunity
for the
given to the
child.
child.
Yeah.
So if it is less than 6 months, continue the breastfeeding. Okay. And other than breastfeeding, some food I told you, some
Okay.
hydration.
Okay.
So some nasal drops
Nasal
can be
drops.
given.
Okay.
Some nasal suction apparatus are available, bulbs,
Okay.
where you can put it in the nose and can suction out the secretions.
The
Anything.
block. Oh,
Yeah.
okay.
Little bigger children, steam can be given
Steam,
to relieve the
yes.
nose block.
Right.
Those things can be given
Okay,
as such.
okay.
Other than that, some oral medicines like paracetamol. Paracetamol usually we calculate like 10 to 15 mg per kg body weight per
10 to
dose.
15 mg per body.
Body weight per
kg
dose.
Body weight. Oh,
per dose. We
Okay.
can calculate and give it
Okay.
if possible. Otherwise, just consult the doctor.
Okay. If I think there are home remedies, but I'm sure there are a lot of parents who are still afraid and
Yes.
scared to follow things themselves. So in that case, all you need to do is immediately rush your child to a doctor. Dr. Bharath, thank you so much. It was an extremely informative session. And you know the drill, ആർക്കെങ്കിലും ഡോക്ടറെ കാണാൻ താല്പര്യമുണ്ടെങ്കിൽ if you would like to consult Dr. Bharath Reddy, all you need to do is ഞങ്ങളുടെ വാട്സാപ്പ് നമ്പറിലേക്ക് മെസ്സേജ് അയയ്ക്കുക. ഡോക്ടറുടെ കൺസൾട്ടേഷൻ ടൈമിങ്സ്, കോൺടാക്ട് ഡീറ്റെയിൽസ് എല്ലാം ഷെയർ ചെയ്യുന്നതായിരിക്കും. അതോടെ ഇന്നത്തെ കെയർ ആൻഡ് ക്യൂർ ഇവിടെ അവസാനിച്ചിരിക്കുകയാണ്. ഡോക്ടർ, താങ്ക് യു സോ മച്ച് ഫോർ ജോയിനിങ് us today, and we hope to see you again soon sometime. And also, this brings us to an end of ഇന്നത്തെ എപ്പിസോഡ് ഓഫ് Women's Era. I hope you all enjoyed it. എന്തായാലും ആഴ്ച തുടങ്ങിയിട്ടേ ഉള്ളൂ. നാളെ ഞാനും മാത്രയും 1 മണിക്ക് എക്സാക്ട്ലി 1 o'clock ഇവിടെ ഉണ്ടാവുന്നതായിരിക്കും. Until then, keep smiling and stay healthy.
Women's Era, brought to you by
Sunny Medical Center, Sharjah. Care is here, care is near.